Good morning, Maria. Good morning, Tillamook. There's some smoking deals this time on the Dairyland Varieties. I love listening to that. You never know what people are going to have available. So anyway, I digress. It's Stacie Zuercher, Northwest Senior and Disability Services, and I am here with Ginney Gabel from the hospital, Tillamook Regional Medical Hospital. Good morning, Ginney.
Good morning, Stacie.
This is a twofer for us because we are continuing our conversation from last Friday.
Yes, we were
about
together
diabetes. Then. I know. We're power bonding like crazy. So what do you have for us today?
Well, first I want to make a comment about the Camp Fire in Paradise, California.
Yes.
We at the hospital are very aware of it because that hospital there was Feather River is our sister hospital. And so we're thinking, and I've talked to everybody, it's how many people we know there that, have been passed through Tillamook or been in that area. And so I just want to say if it's hard to know with the false scamming stories coming out about GoFundMe account. It's in the news lately. It's hard to know, well, how can I give and what can I do and does it really affect me? Yes, it does because that could be our hospital.
Yeah.
I mean, I know we all say
scary.
It could be our community, but I really feel that because I have coworkers and friends who live in Paradise and now have no jobs, no homes. They did a remarkable job of getting patients out in less than 30 minutes. 60 patients were evacuated, and I heard the fire marshal say it couldn't have been done better. They were trained. They were ready. They did it. They got all the patients out safely. And I just want to say, if you're wanting to give something and you don't know where to trust, Adventist Health has a fund that will go to help their employees who have lost everything. I mean, sometimes we say, okay, these people have lost, but everybody from the janitor to the CEO lost everything and barely got out.
Wow.
And so they have, of course, have great needs and are in a very difficult situation as to what will happen next. Mm-hmm. So you could go to our website page, and I don't know exactly where, but I know Adventist Health is helping their own employees as much as they can, and there's a place you could donate because it's going to be helping that community. There were a lot of employees, I don't know how many, there could have been 600 that are displaced, and it's hard to know where to give. I'm just suggesting that.
Remind me of your website, the website here, so people can get
Well, if they just put in adventisthealth.org, they'll get to the website, and they can see their different options for how to help. I just think of it because it could be any one of us that could be in that situation and how different life can change in just a matter of...
Well, and the stories that are coming out of this, they're just remarkable.
They're remarkable.
So
they're miraculous.
Yeah.
They're from prayers, I'm sure.
Yeah.
And the way people escaped with cars, having things on their car melt while they're in it, getting through the flames.
Gives me the heebie-jeebies.
Yeah. It is really something.
Somebody's watching them over them that day.
Yes.
Yeah.
So I just wanted to put that out and thank everyone for their support to us because we can support our sister hospital better.
Sure. So you can call Ginney Gabel at the hospital, or you can call me, Stacie at Northwest Senior and Disability Services,
and I can
direct.
Adventist Health website and just put in Adventist Health, and you'll start to get the website and find the information.
And thoughts and prayers are good too.
Yes. Yeah. Absolutely.
Well, thank you, Ginney, for talking about that. It's it's scary.
Yes.
So, on a different note,
we have a doc talk coming up on the last Tuesday of the month. It's November 27th. Dr. Welch, our OBGYN, is going to be talking on a very sensitive subject, something that we don't talk about a lot, but he's going to be talking on urinary incontinence. Of course, he's dealing with females, and he told me, I can have a patient in the office and I'm trying to ask them how everything is. And I may not phrase the question right, and people say, no, I'm fine. But then if you kind of phrase it a different way, they say, well, yeah, I have urinary incontinence, but, I'm getting old. Mm-hmm. So I guess I should just expect that when I laugh or when I sneeze, that holding in my urine may not be the way it used to be. And that is not a part of getting a normal aging that we should just put up with. So he's going to talk that night in a very sensitive way, but about something we don't talk about. Man, we talk about everything else. But sometimes we're afraid to bring this up. And he's going to say it's not a standard part of aging. And there's a lot you can do. There's two types. There's urgency, where you get up every couple hours at night and go, that's not normal.
Excuse me.
And there's also stress, where you cough or sneeze. Mm-hmm. And that's not normal, no matter how old you are. And where
I coughed. Did you think I demonstrated what you were talking about?
I wasn't going to ask.
Anyway, go on.
But one thing, when you go to that's his field of expertise, the female pelvic area and everything that happens.
Sure.
And so you can go to him or Dr. Gherkin, his partner. And so what they first do is see if there's some physical therapy treatments that can help. And there's a whole list of physical therapy treatments. They're going to be treating the muscles of what we call the pelvic floor. They can be injured. They can be tight. They can cause you pain or just not be functioning. And there can be some physical activities you can actually do. We have two female therapists, and this is their specialty.
Oh, wow.
To help you strengthen your pelvic floor muscles or see if there's another disorder and how we can deal with it through a variety of things. What can cause this? Well, bladder pain can be from a lot of issues. Painful periods can lead to this. Pelvic pain, constipation is a problem with this. Bowel disorders. After childbirth, things can be different, and you may think, well, it'll heal up and be fine. The age doesn't really matter. There can be a lot of issues that could be causing you this problem. And so through looking at physical therapy, then we can decide if that doesn't work, there are other treatments way before surgery.
Oh,
and he is saying, if you think, they'll just have to do surgery, not necessarily. But it should be evaluated, and you don't have to live with this embarrassing problem.
Okay. Well, that's really good information, because I think that, women of all ages should know.
Yes.
Ask questions. Talk with your provider, because what you think might be normal or you just kind of put up with, it doesn't have to be like that.
It doesn't have to be like that. It's true.
And I love that there's some non-invasive, non-surgical treatments to start with.
A lot of things. And we have two experts here in our rehab department that can discreetly help you with gaining your control back. It's just maybe a little thing in life, but it might not be so little. As we get older, some of these things grow. And I remember a lady who said every time she had to go out to the store, she had to pack up extra clothes and tissues and a bag with Depends and things, because she had trouble in the store. She had to go in the bathroom for a half hour every time she went out.
Well, yeah.
And you don't have to live like that.
Well, and this is significant for elderly
Absolutely.
women too,
yes.
Because when I worked in the nursing homes and did that for years, sometimes people wouldn't want to drink as much water because they knew that they would have problems, and that's probably a lot of ages, frankly.
Yes.
So there's a bigger picture, that happens, that you can change your diet.
Or even if you're just more sedentary, you can have difficulty getting up to get there. You may think, well, I'm just not going to drink.
Yeah.
And then there are a lot of other things go wrong.
Sure.
So.
Well, that's very exciting news.
I understand some people may be ashamed to show up, or so I know that they're going to pull the blinds, and they're going to be in the library in one of the conference rooms there. It's 6 o'clock on Tuesday night, November 27th. If you want to bring a friend, or if you want to go for someone who's having the trouble, your mom, sister, it doesn't matter, come. They'll be very discreet. They won't ask you any personal questions. There won't be anybody. Raise your hand if you...
Sure.
No. And Dr. Welch tells me it will be short, probably about 30 minutes.
Oh, okay.
And he'll give you all the information you need to know to help you solve this issue.
Sure. Well, that's it's a very... private issue. And so people often don't want to share those things and talk about those concerns.
So if you absolutely do not feel you can go, the Office of Women's Health, Dr. Welch and Dr. Gherkin are the specialists in this. You could easily get an appointment with them.
Sure. And I love that there's a couple of physical therapists there that are experts. That's fun too. So just one more way that Tillamook Regional Medical Center is supporting our community.
So again, Doc Talk on Tuesday, November 27th, 6 p.m. at the library.
Great. Okay. So I think with that, I'll just take a quick little break here. Where do you go to find almost anything you need for home improvement? I'll tell you where. Rosenberg's. Rosenberg's has been your local connection for anything you need to build and finish your house to perfection. Carpet, cabinets, paint, electrical, plumbing, nuts and bolts, fencing, windows, doors, and so much more. All those items in one place, but that's only part of the story. What really makes Rosenberg's your first stop for home improvement is their people. Their knowledgeable, friendly staff is there to help you through any project. Any question from what paint you should use to how to install a new shower valve, you can get the help you need and do it right the first time. Stop by Rosenberg's today to rediscover what you've known all along. It's better to shop local and work with great people that you can see every day. Build it, plumb it, wire it, paint it. Rosenberg Builder Supply. And if you're just tuning in, this is Stacie with Northwest Senior and Disability Services. They graciously here at the station allow me to dive bomb them and be a guest host a couple times a month. And so I'm enjoying some time with Ginney Gabel from the hospital. And we have a couple, let's see. I wanted to talk really quick about a benefit that's coming up. Thanksgiving dinner, Thursday, November 22nd. The Schooner, once again, the Schooner Restaurant and Lounge and the Upstairs Bar and Grill out in Netarts will be hosting a Thanksgiving dinner benefit on Thursday, November 22nd to support our local Oregon Food Bank Tillamook County Services. 100% of all proceeds will be donated to the food bank. I'm so excited about this. I think this, if my mind serves me correctly, which that's questionable, but I think this is the third year, maybe the fourth, and they do an amazing job. So both the Schooner and Upstairs will be serving amazing Thanksgiving meals complete with all the trimmings and desserts. Dinners are served from 11 a.m. to 5 p.m. and all meals are donation based only. So Thanksgiving is about being thankful for what we have and giving to those who are in need. We are hopeful that guests will give generously towards the fight against hunger here in our community. And for those who are able to, who may be unable to give, please enjoy a meal on us. No one will be turned away. So reservations are strongly recommended for the Schooner, but are not required. You can call 503-815-9900. That's 815-9900 to make a reservation or get more information. The neat thing about this benefit is that all the proceeds, as I said, they all will be donated to the food bank. But the other piece that's really cool is that it's to the Tillamook Food Bank. So it all stays in our community as well. So thank you to Tommy and Mark out there in Netarts for connecting to the community and just doing such a wonderful thing for the up and coming Thanksgiving holiday. And then in addition to that, but wait, there's more. Wednesday the 21st, they're also doing a silent auction bake sale. And proceeds go to the food bank for that too. The event's from 4 to 7. Baked goods can be dropped off anytime the day of the auction, and each participant will be asked to complete an entry form with their name, contact information, and baked goods. So you can definitely contact out there and get more information.
Where's the bake sale? Oh,
the bake sale is at the Schooner and the Upstairs. So they're both hosting it. So more information if you didn't get that number, 815-9900. So anyway, I wanted to make sure we got to do a little plug for that because that's a really fun way to kick off the holiday season. So I'm going this year. I'm very excited. I'm always out of town for Thanksgiving, but I'm laying low and staying local with family here this time. So
that's great.
Yeah.
And Thanksgiving is less than a week away.
I know, isn't that crazy?
When did that happen?
It's this whole year, it's just flown by. I was thinking about Christmas this last couple of days and going, I better get on it. So anyway, back to biz about, we've talked about the doc talks, and we wanted to continue our conversation about diabetes from last week.
Yes, we had an annual day diabetes seminar on Tuesday, November 6th.
And I hear there were more people than ever that joined.
We had over 70.
Wow.
And people from the community. It was, a free event. We've been doing this for, I'm going to guess, over 20 years that we've been offering this one-day seminar. And we had a good lineup of people talking. We had a doctor from OHSU in their aging center talking about Alzheimer's. We had Dr. Bowman, John Bowman, talking about insulin resistance. Dr. Betlinski was there. I'm going to talk more about him. And just a whole lot of people talking about different aspects of diabetes and health.
Neat.
And because not everyone could get there, I said to Dr. Betlinski, would you repeat your talk in the evening? We had a lot of people working who couldn't. So he agreed. So my Club CHIP, which is a monthly presentation at the Adventist Church, lower level, We do this once a month. Everyone is invited. You don't have to have gone through the program. You don't have to have any interest in the program. It's free, 6:30 to about 8. We have speakers or a video on a health topic. It's once a month, the third Monday, and Dr. Belinsky is going to talk. And we want to emphasize avoiding the risk of the diabetes epidemic, because we're going to start hearing more and more that diabetes is actually an epidemic. Dr. Neil Barnard from Washington, D.C., who's been a very good instrument in moving the reversing diabetes information into the general public's awareness, he compares it to the Black Plague. The Black Plague in Europe in, the 1400s, just devastated. 50% of the people died from it. Mm-hmm. He's saying diabetes is an epidemic. It's coming. If you're having blood sugars that when you go to the doctor, the fasting, that's the one they take first thing in the morning before you've eaten, if that's starting to rise from the 80s into the 90s, the low 90s to the high 90s, the high 90s to 100, you're headed there. Mm-hmm. If you don't make some changes, you are headed right there. And I think the scary thing is research is showing that a diabetes diagnosis can take 12 years off your lifespan.
Wow.
12 years. And those years before that aren't necessarily fun. You're having problems with your eyes. You're having problems possibly with your kidneys, with wounds that won't heal, with possibly strokes, maybe even heart attack. It just is not a pretty picture. And we've been told over and over, well, it's not curable. You're just going to have to live with it. And that is not true.
And you told me a story. I'm trying to remember what it was, of a gentleman that, you're giving me a look like you do. And I can't remember what it was. We were just talking on Wednesday, and there was a guy that he was just going down the wrong path. And I can't remember. Oh. Well, there's another one there, and this is how hard it is to change behavior. I had another person tell me about a story of somebody who literally had to have an amputation due to their diabetes. And this doctor was saying, I'll help you. Let's do this together. And the guy said, well, I'm probably going to lose another limb, because it was just so overwhelming to people to even know where to start. And it doesn't have to be.
No. That's why we want to start emphasizing to people that you need to look now, early, before you start to say, I can't feel my toes. That's way down the line. And that really, there's not near as much as we can do at that point as we could do when you say, my blood sugars used to be in the low 90s. Now they're creeping up to 100. Okay, start. Start now. And what Dr. Batlinsky is going to talk about, and this is Monday night, this coming Monday night, November 19, 6:30 to 8. He's going to start talking about what is diabetes and what can you do early on. We talked last Friday about the risk factors, so we're going to talk about that briefly: age, gender, history in your immediate family, mother, father, sister, brother, whether you've had pregnancy, during your pregnancy you had diabetes that increases your risk. And we'll talk about those briefly and give everyone the survey. They can tally up what their high risks are. And then we'll talk about where do we go with it and what do we do. It is totally lifestyle driven.
Okay. So one thing we didn't talk about last week, and I think it's a great question, that to just, I just realized I'm tooting my own horn and giving myself props for a question I haven't asked yet, but it's important. So if somebody's not checking their numbers and they don't even know how to do that, and they're scared to go to their doctor, but what are things that people feel and the signs that may make you start thinking about this? So if you eat, are you getting spazzy? Are you getting low energy? Can you talk a little bit about that?
I can. Yes. Okay. So it's sort of like when your car is running out of gas and you have time to do things to fill it, right? And eventually it's going to start coughing and sputtering, and then you're out. Mm-hmm. We've been waiting until you're coughing and sputtering. So, and that's really the signs I'm going to talk about. So you're going to be, you could be gaining weight. You could be feeling tired all the time, excessively thirsty, hungry. And part of that is because the fuel you're eating is going into your blood. It digests and goes into your blood. Then your blood wants to take it around your body to all the cells that are crying out for energy so they can run your kidneys and help you see and keep your hands moving and keep the nerves working in your body. So all those cells need energy. But with diabetes, we can't get that easily into the cells. It stays in the blood. And so I'm feeling like I'm tired because I don't have any energy. My cells don't have the food, the fuel they need. And I'm feeling thirsty because my blood is actually getting thick. Like, this is very simple, but like honey. Because there's so much sugar in the blood that can't get out of the blood and into the cell that's hungry. The cell says, give me food, give me food.
And I've heard the side effect that you're going to be thirsty. I didn't realize that was why.
Mm-hmm. That's why. And so you're thirsty and you're hungry, and of course you're gaining weight and you feel fatigued. But again, that's the sputtering of the car running out of gas. We want to be watching this gauge much earlier. So it is important to go to the doctor at least once a year and have things checked, because you don't necessarily feel that the car's running out of gas, do you?
Right.
When it's halfway down, can you tell, oh, that gas tank's half empty? No, you look at the gauge.
Or you go get a coffee.
Yeah.
People have energy drinks and all these other things that they use to keep their energy up.
To boost them up.
Yeah.
But then a few hours later, they're down again. And what diabetes does is it ruins our circulatory system. It ruins the vessels in the inside, the delicate lining inside our vessels that keep them soft and pliable. They start to erode that. Like what happens if we had tires on our car with the studs. If we made those studs a little deeper and put them on all the cars and drove all year long, what would happen to our roads? They would start to crumble and break. They get torn up. The inside of our vessels get torn up when we have high sugar flowing through them. It's not good for them. So that means every area of our body, every cell that's trying to be fed by them, from the toes to the top of our head, the whole system, it's not just one place, the whole system begins to get damaged. And that affects our kidneys, our nerves to our feet. I just heard the story of a man who was out on the beach walking. He's heavy. He knows he has diabetes. He's trying to figure out what to do about it. He was with friends. They set up a campfire.
That was the story.
Yeah. So he's keeping his feet warm at the fire because he had sandals on. Mm-hmm. He gets home and he finds he has second and third degree burns on his toes because he could not feel the heat on his feet.
Oh, that just creeps me out. That's crazy. And it's true. It actually is real.
Yes. Not only could he not feel his feet, now he has a wound there with poor circulation to his feet, so it's going to take a long time to heal.
Yeah.
Or, as sometimes happens, it doesn't heal. Mm-hmm. And there gets to be what we call necrosis. It doesn't have oxygen and proper nutrition to heal, so the tissues begin to die. And then we're looking at amputations.
Yeah.
So all of that has to do with our circulatory system and what diabetes does to it. That's why diabetes, if someone has diabetes, the doctor says, do you have a heart attack too? Nope, no heart attack. Well, you know what? You might as well have one. You've had that much damage to your circulatory system. So we've got to get it early. We've got to catch this early. I'm going to be doing some A1Cs Monday night. Mm-hmm. That's one test. We can look and see how your average blood sugar is. It doesn't require fasting, so I can do it in the evening, the morning, it doesn't matter. And we can begin to see, is that number rising? Because that gives us an average of 3 months what your blood sugars are. When we do a fasting finger stick, that's right now. Right now.
And so the A1C, it's a blood draw. They look at the last 3 months, or finger poke. Okay, mm-hmm. Even better. So can you find out what your number is right then, or does it have to go to a lab?
It takes 5 minutes.
Wow, that's great. So Monday night, again, 5:45 at Club Chick. Anybody's welcome. Mm-hmm. Tillamook Adventist Church in the lower level. It's a potluck. And then for $10, you can have your A1C checked by Ginney. That's fantastic. So neat. Well, I'm going to, with that, I just realized I have to just do my next little ad, and that's what this is about, because we really want to plug it because it needs to happen. How would you know if you were at risk for diabetes? What are the risk factors? November is Diabetes Awareness Month, and we are highlighting the prevention and treatment options. 26 million people have it now, and it's estimated that this will double in the next 20 years. You don't need to be one of them. Know the early signs and take charge now. A1C testing will be available for $10, as I said, and this is sponsored by Adventist Health Tillamook Regional Medical Center. Dr. Paul Betlinski will be the presenter. Like I said, 5:45 is the general potluck, and 6:30 the program begins. So if you need more information about the program or about this specific event, it's Monday the 19th. It's always the third Monday of every month. They have various topics, and you can call Ginney Gabel at the hospital, 503-815-2270. I'll leave this flyer here at the station, so if you do end up needing that information, call the hospital, call Stacie at Northwest Senior and Disability Services, or the station, I'm sure, would be happy to share that too. So good stuff.
So we just want to remind people, Tuesday, November 27th for Doc Talk on urinary incontinence. You don't have to come for yourself. You can come for someone else. Bring a friend. It'll be very discreet, but a good discussion to help you with something that is not normal aging.
Right.
6 o'clock at the library.
Good events coming up. Okay. So what else is on the ticket for us to discuss today?
Well, in January, just give people a heads up, that will help with diabetes. We have a couple classes we're starting. Diabetes Undone helps you learn the steps that will help you reverse your trip to diabetes land.
Okay.
We have the CHIP program that will start, and this is an intense lifestyle change program. It will help you with your diabetes, heart disease, cancer prevention, high blood pressure, high cholesterol, all those things that lead us into chronic disease. And you can call me about more of that. We also will be starting a depression and anxiety recovery program.
Oh, wow.
Depression and diabetes go together.
Mm-hmm. And heart disease.
And heart disease.
Yeah.
And caregiving, you mentioned this was Caregiving Month. Mm-hmm. Caregivers have a much higher risk of depression, anxiety.
Absolutely.
There are things, lifestyle things, not just drugs, but lifestyle things that can help you move away from that, and you do not have to have it as a diagnosis for life. Talk to us about Caregiver Month.
November is Family Caregiver Support Month, and Ginney and I do a lot of classes, and we each have a support group here locally, and we were just talking about, these people who are caring for someone in their home or a neighbor or someone that they're responsible for, another adult. It's tough work. It is a 24/7 job. And what I think about as far as caring for someone that has a diagnosis of dementia specifically, my years in memory care, the staff could come in, punch a clock, and they'd come in for 8 or 9 hours a shift or more, and then they could leave. And there was a high amount of caregiver burnout, because it was a tough job. And now, and we have people every day that are doing it for a loved one in their home. And so I wanted to bring a little attention and do a little plug, because someone working in a nursing home, they don't have this lifelong bond with a mother or father, grandparent, loved one. And so there's a lot of dynamics. And I think a lot of times I just was speaking with a gentleman the other day that he waited a long time before he said, wow, this is really more than I know how to manage, and I don't know what to do. And we started talking, and immediately we kind of identified some root causes of some behaviors that were going on with his loved one. And I just kind of saw his body language change. And we felt it in the Savvy Caregiver class earlier this year too. There was a woman who came, and she was taught, she's primary caregiver for her mom. And the first couple of classes actually, just would sit in her chair and cry. She didn't even really talk that much because she was so overwhelmed and so tired, and hearing everybody's stories and relating to that. And by the 6th class, the final class, she came in smiling, and, she really had some coping skills. And so if you're providing care, please don't hesitate to call one of us, Ginney at the hospital, who she does it's the
Alzheimer's support group.
Alzheimer's support group, and the class that you do, the
Powerful tools for caregivers.
That's the one. Whew. And I have a support group that's for family caregivers as well. And so often people say, I didn't want to come, and they wait, and then they get there and they go, why did I wait so long? And even if it's just having a conversation or having a phone number to call so that you can process, wow, this is new. I also get a lot of, kids that come home here we go into the holidays, and they come home and they haven't been here for a while, and they see that mom's fallen, and then there's things going on, and the house is starting to not be taken care of the same. And it's because the world shrinks sometimes when you're isolated. And so, let's have those tough conversations. People don't want to. Sometimes they're like, well, mom's going to do what she's going to do. And so if that's the case, what do we do to just support her and have some boundaries so that we're caring for ourselves too? Because I could tell a lot of stories about people who have tried to care for someone, and then they're the ones that become sick, and things go left pretty quickly, and you're nodding your head a little bit, because it is the reality of it. And, my goal and yours too, is we want people to feel supported. We want people to be able to stay in their homes as long as possible. And sometimes just having some healthy outlets and looking at things a different way, hopefully will bring a little peace and some balance or some validation. Or I always tell people, if I come in and you're screaming on my voicemail just to get it out of your system, I'm okay with that, and so don't be afraid to reach out. There's lots of resources throughout our community that can help people.
And maybe you're a neighbor and you see a situation and you're not sure what to do with it because it's not your relative or a friend of yours. Stacie's the one to call and say, can someone do a welfare check? I'm concerned about. We need to be neighbors, to our community. I think we're fairly good at that, but I don't want people getting overlooked. Someone will notice something.
Well, and I think that's very often people don't know what to do, or they just kind of go kick it into get her done mode, and just doing everything they can. And it doesn't have to be that way. Yeah, it's tough.
I think of going back to Paradise, California. I wonder, was everyone getting out of their homes? Did everyone know to get out? Was anyone watching for those that are in their home? I read a story of a garbage truck who was making his rounds to check homes, not to pick up garbage.
Wow.
He was checking everyone on his route, and he found a little lady in her home, and he rescued her into the truck.
Wow.
The fact that it wasn't protocol to do that was set aside. A life was saved.
Every time we start talking about this, I feel like chest pressure when I start, because I can feel like what that would be. So scary to be in that situation.
Well, in these situations, we can learn from it. How do we watch out for everybody?
Yeah.
How do we, and this is a great example of watching out for someone in your neighborhood that you don't see doing the normal things anymore. Who's visiting? Who's taking care of them? Are they driving to the store safely? It's important that we do that.
Sure. And sometimes there's just some really basic things that can be, safety evaluation wise and making a few changes in the home, or maybe adding a little bit of help. It doesn't have to be a big, nobody's going to come in and make somebody make a change. People have the right to live the way that they want to, but sometimes just having a few resources can be a pretty big deal so that people can, feel supported and stay in their homes, so.
And I'm thankful for Northwest Seniors because they're there to do that.
We try.
Yeah.
Yeah. There's lots of good programs. And a lot of people think, this is a good opportunity for me to say, a lot of people think the state's just going to come in and take my house away or something. Nobody has the right to do that. We're there for resources, information, support, guidance, those kinds of things. And so that's the first thing. And the second thing is people think I'm not going to qualify for anything, or I don't want to go on Medicaid, or I have gotten all the resources that I can. It's not just for people that need Oregon Health Plan or Medicaid. There's Older American Act funds that are set aside for people, and it's kind of for prevention, and it's for those people that are not using services but really need support. So don't forget that. So with that, got a few announcements today. I'm glad we got to talk about that. And again, salute to the family caregivers out there that are doing all this wonderful work for our seniors and people with disabilities. So Adventist Health was here today, and thank you so much, Ginney, for helping out and popping in and giving us all this great information about your up-and-coming events. And our sponsors were Tillamook Regional Medical Center and Rosenberg Builder Supply. Monday, we'll have Billy Cloud talking about the search and rescue dinner. That's exciting. Senior meals, reminder, 11:30 at St. Mary's by the Sea in Rockaway, every Monday, Wednesday, and Friday. At noon every day in the Kiwanis Community Center in Pacific City, as well as Tillamook Senior Center on 4th and Stillwell. And Tuesdays and Thursdays, I always say I'm going to add that, and I always forget, so I'm doing it right now. Tuesday and Thursday in Nehalem. At the church up there in Nehalem, too. The Pioneer Museum is holding their second annual MOOC Book Fair Saturday. Meet a variety of local authors and get some unique books and gift options. I went last year and bought a couple books that I just really enjoyed. So heads up, Tillamook City Hall will be closed today as they prepare to move to temporary offices for a period of time while City Hall is being renovated. There's a craft and bake sale at the Eagles Lodge on Stillwell across from the library. Friday 10 to 3 and Saturday 10 to 2. Proceeds benefit the Marine Mills Center. So there will be a silent auction both days. Winners do not need to be present. And there's a reminder that the search and rescue dinner tickets are on sale now. The Tri-Tip dinner is held December 1st and benefits the Tillamook County Search and Rescue Program. Contact the Sheriff's Office 842-2561 for more information. Again, this is Stacie at Northwest Senior and Disability Services. Thank you so much for listening today. I hope you got some good information. And thank you so much, Ginney, for gracing us with your presence and all this wonderful things that you do.
You're welcome.
Okay.